A lot of people don't make changes, not because they don't think the changes would get them the results that they want. They don't think the changes are possible. It seems like Mount Everest to them. I can't make people change their behavior or change their lifestyle. I just can't. I can only encourage and help you make those changes. I could give you the best program possible. It doesn't mean you're going to do it. I would much rather have a suboptimal plan that you're going to execute with some enthusiasm over a long period of time than the perfect plan that you're not going to engage with after 2 weeks. A lot of people are reluctant to change because they can't see the path. They know they need to make a change. They want to make a change, but they feel unmotivated, like it's not possible because they can't see how. So if we can give them a path, even if it's not a great path, and they can kind of see through the mist, then it's like, oh, okay, then it becomes a catalyst for change. Welcome back to another episode of the Build Beyond podcast. This is a continuation of our previous podcast. We're talking about motivation. As always, the Build Beyond podcast exists to challenge and guide you so that you can reach your full potential. And I think motivation is one of those things that stalls people. It's a roadblock. It's a hurdle that turns into a wall. And if you don't find a way to find your motivation and to keep that forward momentum, that wall just seems to get bigger and bigger and bigger. Years go by, maybe even decades, and then people just become hopeless. So the motivation piece is huge. And I think my growth as a healthcare provider has shifted. I've shifted a lot. Initially, it's about what can I do to a person to help them? And progressively over time, it's been more about what can I do to help the person help themselves, and being more of a guide and less of a mechanic, if that makes sense. Because as a chiropractor, I deal mostly with chronic issues, and a lot of these are lifestyle based. So I'm not a surgeon. I don't prescribe medication. So I'm not a mechanic in that way. I can't actually go in and fix things. But I can act as a guide. And I think the motivating piece is huge. So I'm trying to give you a window into finding your motivation or selecting a healthcare provider who has the skills to help you find that motivation and then keep you on the path. So let's do a quick review of, if you didn't listen to the last episode, I'm going to give you like a 90-second review of what we talked about. So what is motivation? Motivation is whatever actually gets you moving. So it could be, and by moving, we're talking about acting, changing, growing. No one is unmotivated. And I think that's maybe like the key thing from last episode. There's a lot of people out there, I meet them every week in clinic. They know what they need to do. They've failed before. They're unmotivated. They feel like they're unmotivated. But that motivation is in you. We just have to find it. And there are a lot of different ways that we can do that. Motivation arises from both internal and external sources and is often interpersonal. So it's something that happens between people. I shared last time, my motivation is to live long enough to see my grandkids. I'm in my mid-40s. My oldest is 6 years old. Men in my family, I think I didn't win the genetic lottery, die young. So I want to be the first Netley in a long time to have a relationship with his grandkids. So for me, that's pretty strong motivation. And there's an interpersonal aspect to it. Now, why don't people make changes? I think let's talk about just like an easy chronic disease. Not easy, but you can picture this. Say I had 1,000 people who were diabetic and struggling with body weight. What do you think the percentage of those people would be who knew that diet and exercise are going to have a huge impact on their chronic issues? It's a high percentage. I would be willing to bet 100, 99, 98. I mean, it's really high. People know that, but they still don't do it, even though they understand. So this is this concept of ambivalence. So we ask this question: what is it that inhibits people from making a change, especially if you know what change to make? Reluctance is a normal human response when faced with change and growth. We've all experienced this. There is a cozy familiarity with the status quo. We just get into these patterns and it becomes hard to break out of it. That's our status quo. So hesitancy can be about whether the change is important, whether it's necessary, or whether it's advantageous. We don't know sometimes. Is the juice worth the squeeze? Essentially, that's what you're asking yourself. There may also be doubt as to whether it is even possible. This is huge. I think a lot of people, they don't make changes, not because they don't think the changes would get them the results that they want. They know that would happen. People know if they ate better and they exercised and they slept better and they did all these things, they know that it would help. But they don't think the changes are possible. It seems like Mount Everest to them. So why even, it's like this all or nothing mentality. I can't do it, essentially. And I think that holds a lot of people back. So when considering change, a person commonly experiences what we call ambivalence. So that is simultaneously wanting it and not wanting it. We've all been there before. So often a new way of doing or being has both perceived advantages and disadvantages. This is where we're talking about pros and cons. We've all played this game before. So the balance of pros and cons predicts whether change or growth is even going to happen. Okay, I think that's a good summary. That's kind of where we left off. Everyone is motivated. Motivation comes from within, but there isn't a personal aspect to it. We just have to find it. If you feel like you're unmotivated, we just got to dig a little bit deeper. This natural ambivalence, so wanting it and not wanting it, is very normal. It's not pathological. There's nothing wrong with you. It's very common. And you have this pro and con battle going on basically within your mind. And for a lot of people, even though you know what to do and you understand how to do it, it doesn't seem possible. You failed too many times and you feel too unmotivated. So it just seems people just give up. All right. So now we're moving on for this episode. If that's you, if I'm speaking to you or I'm speaking about someone who you know, and you say, okay, well, what's the next step? What do I do? There are ways that you can work on this on your own. There's actually a really good workbook that I stumbled on. If you're interested in that, shoot me a message, shoot me an email or text me. Or my contact info is in the description of this, and I'll send you, it's a good workbook. But if you're going to go work with a healthcare provider, which can be really valuable, this is a process that could get you results. I've shared this on the podcast before, and I've actually asked other healthcare providers this question. And a number of years ago, a close friend of mine asked me a question. We were talking about healthcare, we were talking about chiropractic, and he said, well, how does the average person know if they're selecting a good chiropractor? How does the average person know if they're selecting a good physical therapist or a good physician? Because everybody seems like they know what they're talking about. And I didn't really know how to answer that question. I've thought about it a lot over the last few years. And when I've asked other healthcare providers, I think a common theme that comes up, or has come up on my podcast, is that you want to select someone who's listening. And you want to select someone who's willing to treat you like an individual. And you want to feel heard. And you want to feel like they're adapting to you, not making you adapt to them. And so the process that I'm going to go through right now, or I'm going to highlight, is how I try and operate. I'm not perfect at it. I wouldn't even say I'm good at it. I'm trying to be good. But this is the idea of a practice. This is actively what I'm trying to do. So the first thing that we would have to establish, or you would need to establish with a healthcare provider, is, can we walk together? Because if you have a chronic issue, whether it's pain, obesity, diabetes, you have to walk a path. There are interventions for all of these things that can give you short-term benefits, and some of them are life-saving. But for most of us who are healthcare providers, those of us who aren't surgeons specifically, we can't go in and fix you. We can guide you on the path. So there's this, if you're deciding whether or not we can walk together, it's a decision I have to make too as a healthcare provider. a lot of times people come in for a new patient visit, and I'm not necessarily going to work with them. I have to decide. I have to make, is this someone I can walk with? And can I help them with their issue? Do I feel confident that I can do that? And if I do, is it the right relationship? And sometimes it's just not. And I have to be honest with people. So you need to decide, first and foremost, can we walk together? So these are the questions that hopefully are going through your head, or like, what are we actually doing here? Do you understand how this person can help you? Am I safe? Can I trust this person or this place? I think that's foundational, because if you don't feel like that, then you can't walk with this person. Will I be listened to and heard? That's another key. Will my feelings and values be respected? Also a key. I think a lot of times when I ask people about previous healthcare providers, this isn't just chiropractors, just in general, and so you saw someone, it didn't really work out, and I pry a little bit, well, why? What was the reason? It's not uncommon because people don't feel like they were heard, and they don't feel like their values were being respected. So maybe like a treatment was trying to be pushed on them, or that's how they felt. Whether or not that's true, that was their interpretation. And then you want to ask yourself, can this healthcare provider really help me? Do you have any confidence in this? Now, these are all important questions to ask. And this isn't necessarily something that has to be answered on the first visit, but if your spidey senses are tingling because at any point, because on the balance, the answer to these are no, or maybe, or I don't know. It's not that it's a bad healthcare provider. Maybe you guys just haven't connected. Maybe it's not the right person for you, or it's not the right time to work with that provider. Okay. So now let's say we've established that relationship. We have decided that we can walk together, right? You understand what you're doing here. You feel safe. You feel like you're being listened to and that you're being respected, and you at least you're open to the possibility that what we can do, that I can help you. Now we have to focus on something. So we know we can walk together, but where are we actually going? We have to be on the same page there. And that might actually shift over time. So when we're trying to focus on where we're actually going, our conversation needs to be directional. It needs to be purposeful. And we need to be moving toward an intended goal. And that's a goal that you set. And so this is another thing that I think when I talk to people and they're coming to me, usually I'm not the first choice because I don't take insurance. So they've been to a lot of other people, and this isn't anything against insurance-based providers. This is just my observation. People feel like they didn't really understand the plan. They didn't understand the purpose. They had a vague goal, maybe of getting out of pain, but they don't really know how. It was just they just went, and either stuff was done to them or they just did stuff. And they didn't really understand the direction or the purpose of a lot of this stuff. And that's a problem, because a lot of that therapy or the treatment or whatever was being done was probably great, but it was done out of context. They didn't understand. The person didn't understand. So it's not about necessarily changing the exercises or the interventions. It's about improving the communication. So when we're focusing, when we're directional, when we're purposeful, when we're moving towards that intended outcome, we need to gain a sense of where we're going and what this helping relationship is intended to achieve, and what topics will be most helpful to discuss. We've got to put a target on the wall, and either we hit that target or we don't. And if we miss the target, we can measure, and we can acknowledge that things aren't going to be perfect. We're going to miss the target from time to time, but we can recalibrate and we can get closer to that goal. And then if the goal shifts, we shift the target or we get a new target. So if you're not measuring things, you can't really manage them. And I think this concept of focusing, once you have this foundation of trust and really setting goals, because you're setting parameters for success and failure. And I think that there's a lot of honesty and transparency there. So you also need to realize when you're dealing with a healthcare provider, we have a fixing reflex. For most of us, we were taught to go in, ask very specific questions in a very robotic way, do some very specific exams, be incredibly objective. I gotta pause. I'm back. I have a dog. She's old and she's kind of sassy. And so when she wants to leave a room or get in a room, there's no patience. So we've got a fixing reflex. We're trained to fix things, even though sometimes we can't fix things. We're not mechanics. So we ask questions in a robotic way. We analyze things in a robotic way. We're very objective. And then we start prescribing stuff. That is a hard mentality to get out of. It works quite well in certain situations. So if you are having a heart attack and the paramedics show up, you want them to be robotic. You want them to go through a very specific sequence to save your life. Same thing if there's trauma, surgery. There's a lot of instances where the fixing reflex is not only a good thing, it's required. I don't deal with emergency medicine, although that's not true. I have a board certification in sports medicine, sports chiropractic, and a huge part of that is triaging trauma. It's basically like I'm on the sideline, someone goes down. Can I keep them alive and keep them safe long enough for them to be transported to the hospital? And those few minutes can be vital. And it's not just about the athletes. It's about like, hey, I'm on the sideline, someone has a heart attack, a spectator. Can I handle that? So there are times when the fixing reflex is, it's vital. But when we're dealing with chronic issues, and I think this is part of the problem, is this ambivalence. So if I get 1,000 people who are diabetic and are struggling with weight gain, guess what percentage of them know that they should be dieting and exercising more optimally? All of them. So for me coming in as like with my white coat and being like diet and exercise, and handing them a pamphlet, like they're looking at me, no kidding. Obviously that would help. And then for me with my fixing reflex, it's like, hey, I prescribed it. I told them what to do. They're non-compliant. I'll label them as non-compliant. I guess they don't want to get better. And so I'm not trying to take the responsibility away from the individual, but there is a better way to communicate this. So understand that your healthcare provider probably, we have a fixing reflex. I'm trying to abandon that as much as I can, other than in specific situations. So I can't make people change their behavior or change their lifestyle. I just can't. That has to come from you. I can only encourage and help you make those changes. So prescribing goals does not mean that you're actually going to accept them. So you come to me and you say, I got this problem. Here's my goal. I want to get there. I could give you the best program possible. It doesn't mean you're going to do it. So that's why developing this relationship and going back and forth, I would much rather have a suboptimal plan that you're going to execute with some enthusiasm over a long period of time than the perfect plan that you're not going to engage with after 2 weeks. Does that make sense? It's not about perfection. It's about what you will actually do. And for these chronic issues, I've got to keep you and help you move in that direction, sometimes for years. I mean, some of these issues, they took years to develop. It's going to take years to unwind and get you to where you want to be. And then it's, for a lot of people, it's a consistent effort over time to maintain it. And people, I can't just tell you what to do. It's just not going to work. It never works. So now what we've done, we've developed our relationship. We have decided that we can walk together. We've focused. So we have said, look, we're going to be directional, purposeful, and we're moving towards these goals, right? This is success. This is failure. This is where we're going. Now we need to know why we would actually go there. Like, why are we doing this? And this is huge because a lot of people don't think about this. And this is, I think, foundational for motivation. And I need to know this because guess what? Guess what people pay me to do mostly? Keep them on track. Accountability. If this is going to take a long period of time, I could give you the perfect plan and I could probably take me an hour to write it up, and I could hand you a 10-page document and be like, I could be your own ChatGPT. You could get all this information on ChatGPT, by the way, or Google. A step-by-step process. Most people they're going to fall off because they need some type of accountability. And I think that's really where, so my job is to come in and be say the unpopular thing and to keep you moving. On the days when you don't want to train, on the days when you don't want to eat right, on the days when you don't want to move, when you don't want to do your stretches or your mobility work, when you want to stay up late, that's where my expertise comes in. That's where I'm that coach. I'm that person holding your hand and walking with you and saying, no, I know you want to go down that path, but we're not moving towards your goal anymore. And that's, in the Marine Corps, we call that troop welfare. So as a leader, it's doing the unpopular thing and making people do things they don't, not making people, but in the Marines, we made people. But for you guys, it's like, hey, we got to do the unpopular, uncomfortable thing right now. We just have to. We have to keep you on this path. It's a slippery slope once you get off the path. So we need to understand why we're making that change. What's your why? I shared with you my why. I want to be the first Netley male in 3 generations, maybe more than that, to live long enough to have a relationship with his grandkids. I didn't win the genetic lottery, and I started having kids late. So, that's a strong why. That'll get me moving and get me eating boring oatmeal and apples. And it's just, when I want to eat chips, it's going to get me to it'll get me to eat an apple or a carrot just to fill myself up. So I think when we get to this point, we've got to start to understand why. Remember that a common starting point for change is ambivalence. We simultaneously want it or we don't want it. And that motivation, that reason why, is going to help us shift that. So part of the person can see the reasons for change and part of the person is reluctant. Let me read this to you. I think a lot of people are going to relate to this. So let's say this is going on in someone's head. I know I really ought to change how I eat. The nurse warned me about some terrible things that can happen if diabetes is uncontrolled, but I'm not even sure I have diabetes. I mean, I feel fine. It was just one blood test and the doctor ordered it and told me that I have it. I know I could stand to lose some weight, and the fast food I eat isn't really that good for me, but it's so easy and it tastes so good. I shouldn't ignore the warning, I guess, but I feel fine. They also said I should get more exercise, and I know that's important, but my days are already so busy. The ambivalence is so obvious, and this is so common. So there are people who can navigate this. They can get a workbook. They can work through this on their own. It is totally possible. But this is like, once on these days, this is when my patients shoot me a text. Hey, I'm having an issue. And we kind of start to work through that. And so it's important, and this is kind of a little bit of a review. If this ambivalence, if this back and forth is going on in your mind, this is totally normal. This is not you being unmotivated. This is you being human. So it is as if there were a committee inside the person debating on how important change is. You've got a committee in your head. I love that. There are advocates for both for and against change, and who will win the debate depends in part on who is given more airtime. Aha! So we're starting to get into some agency. I think a lot of times this is really common when I work with people in fitness programs. So I help facilitate some long-term fitness programs for adults, and oh my gosh, the excuses. I love you guys, but the excuses. Now there's a fine line between excuses and reasons. If you have a fever, that's a reason. If your basement floods because a pipe bursts, that's a reason, right? But excuses, the problem is that when we have excuses and we convince ourselves that they're legitimate reasons. So we've got this committee, it's going on in our heads, and the winner depends on who gets the most airtime. So something that I think is quite successful for the people who actually do it is saying, like, look, okay, you've got all of these reasons, excuses, whatever you want to call them. You've got this list of things like why you can't exercise or why you can't stay on track. Give me some reasons why you can. What could you do? Okay, this week it's not reasonable for you to make it to the gym. Let's look at the training sessions and how could you do any of this at home? Oh, you don't have a bench press at home and a barbell? Could you do push-ups? Okay, so we could do them. You know what I mean? Like I get it. There's a lot of reasons why you can't. There's a lot of hurdles. Cool. Let's just say we can't change any of those. Let's start to look for reasons why you can. Let's look for ways that you can. Let's give that person in the committee in your head more airtime. And let's start thinking about the positive things and just not the negative things. It's not going to be perfect, but we can do something. So arranging conversations about change so that your pro-change advocate in your head naturally gets good time to make the case. That's the goal. It's that positive mental attitude. Yeah, I got a lot going on. Woe is me. I'm living a human life. I'm busy, but what could I do? And it's an interesting thing because people will be like, oh yeah, I haven't exercised in years. Why? Why haven't you exercised in years? You know it's good for you, right? Yeah, I know it's good for me. I just haven't had time. So in the past 10 years, how many push-ups do you think you've done? 0. Okay. So you're saying in the last decade, you've been so busy that you didn't have time for one push-up? Well, no. Okay. You didn't have time to do 10. You couldn't spare 10 seconds a day to do push-ups? Well, no. I could have. Okay, but think about that. If we had a time machine, we could go back in time a decade. And every day you did 10 push-ups. What would that add up to over a decade? That's a lot of push-ups. And guess what? 10 push-ups would get boring after a while. You'd be doing a lot more. That would be a catalyst for more. So now we're starting to think we're giving the airtime to that voice in our head that's saying, we should change. We should do this, right? So we're also starting to make it doable because remember, this is not a linear process. A lot of people are reluctant to change because they can't see the path. They know they need to make a change. They want to make a change, but they feel unmotivated, like it's not possible because they can't see how. It just doesn't seem real. So if we can give them a path, even if it's not a great path, and they can kind of see through the mist, then it's like, oh, okay, then it becomes a catalyst for change. So instead of telling someone what they should do and why they should do it, what we're trying to do what I'm trying to do as a healthcare provider is I'm evoking and strengthening your own why for change. Why do you want to do this? Let's focus on that powerful why. What does that mean to you? And okay, we can't do the perfect plan this week, but what could we do? How much could we accomplish? I think, and I often go back and talk about my experience in the Marines, and I remember early on, it dawned on me that in training, that we're set up for failure. So part of any type of training exercise, especially early on, they don't really care about you succeeding. They want to see what happens when you fail. And they want you to experience failure over and over again to actually get better at dealing with failure. And I don't remember I don't remember a specific instance, but I remember the feeling when that clicked in my head. And a lot of stress went away because it would already be a stressful situation. It was a stressful day. I was getting yelled at a lot. There was a lot of things going on. And then a small group of us would be given a task. And maybe I would be put in charge of it. And then you feel this pressure as a leader. And then you realize, oh, this is impossible. We can't meet that standard of perfection. They're telling us that we have to because they're wanting to see what happens when they apply pressure. So let's calm down and let's acknowledge that we can't be perfect. And if we can't win, how productive can we be in failure? And all of the stress goes away because we don't have unrealistic expectations. We know we're going to fail, but we're going to try our best to be as productive as possible with the tools that we have and the time that we're given. Because we know that even if we were to succeed, this is not the end. There's another task. There's another challenge. That realization it's even if they give me an impossible task, even if I accomplish it, I still got more hard stuff to do after. Like it's not going to stop. It never stops. And once you have that realization, the Marines didn't become easy, but it became a lot more, it became simple or simpler, I guess. Now, I think that's a good metaphor for life. As a parent, we have 2 kids. My wife and I both work. We got an annoying dog. There's just a lot of stuff going on. Schedules never match up. I feel like I spend all of my time deconflicting schedules. Sometimes if I can step back and just say, okay, perfection is not a possibility. Failure is real. I'm going to fail at something. Just how productive can I be in failure? Oh, it's a nice feeling because it takes all that stress away. And I feel like if you're on a health journey or a fitness journey or a chronic pain journey, getting rid of that all or nothing and just saying, how productive can I be, is really important. And remembering that the why you're doing it is really important, right? And you don't need someone like me telling you, well, you should be able to do this. This is how you should do it, and you should be able to do it. Why aren't you doing it? I guess you don't want to change. That doesn't help anything. What we're trying to do is I'm trying to sit there and not like a drill instructor or a mechanic. I'm trying to say, look, we need to strengthen and we need to pull this out of you. We got to get back to your why and then get you back on the path. Right? It's that simple. Not easy, but it's incredibly simple. And this all comes down to communication. So we need to consider the why of change. And sometimes that depends on first seeing a possible and an acceptable how. And this is something that I've already talked about. These are kind of intertwined. Sometimes people don't even want to consider why because it seems impossible. But if we can show them a how, maybe an example, this is how we would do it and this is how I can help you. It is possible. It softens people up a little bit. It softens their attitude and they, okay. Now that you understand that it's at least vaguely possible, can we talk about why? All right. So these two are intertwined. It's messy. It's very rare that we actually go in these steps. I think of it more of like painting a textured wall. You're going to go over it a couple times, then you got to move on to another spot. You got to let it dry, and then you're going to come back. You're going to go over it a couple more times, maybe a different direction. It just takes time. And you're always going to miss something. You could feel like you're done, you're going to come back and so I missed something. Or you come back and one of your kids rubbed up against it, so you've got to fix it. There's just infinite things that go on. And then a year, maybe you get it perfect, but 6 months later, there's something, you get a new piece of furniture and it scrapes the wall and you got to start over again. It's just never linear. It's just not the default or starting point to provide a plan for yourself because of advice or direction alone. You know what I mean? Like, I can't just go in and be like, here's advice, here's direction. And you're like, oh, great, that's a starting point. That's often insufficient and it can backfire. So that fixing reflex of being like, this is what you should do. And if you don't do it, you don't want to get better and it's failure on your part. You're non-compliant. That just backfires. I don't know. I have a friend who's a pediatrician, and I had asked her one time, and this was earlier on in my journey with communication, because that's an interesting population. You've got young kids, a lot of them don't make decisions for themselves. Some of them can't talk and they've got health issues and things have to change. But you can't tell the patient that. You have to convince the parent. And so how hard is that? It's challenging. And I was like, well, how do you feel when someone's non-compliant? And she said something to the effect of, I just don't think about non-compliance. I feel like if they're not doing what they need to do, it's a failure in my part on communicating. I didn't communicate how or why. I didn't explain enough. I didn't give them a realistic path. I didn't honor their values. There's some kind of breakdown, and ultimately that's on me. And I was like, oh, okay. And luckily, this is a friend who's a pediatrician for my kids. So I've had her on the show before. Shout out to Nikki. I don't know if you're going to listen to this, but I need you back on the podcast. Okay. So planning can also be an ongoing process. This is interesting because it's like, most people don't want a cookie cutter plan. So like, oh, you got a rotator cuff problem, boom. I have outlines for stuff, but it's an ongoing process because things are going to change. It is a misunderstanding that once you have arrived at a plan that you're done. All right. So this is a moving target usually, especially with chronic issues. So my role as a healthcare provider, a lot of times, even after we have a plan and we get you going, is to continue to help you try to implement the plan, or at least to follow up to see how things are going. Because again, accountability it's a big hurdle. It's a big reason why people don't reach their goals. So the implementation of the plan for change or growth ordinarily includes some setbacks. We know setbacks are going to happen. So 2 steps forward, 1 step back. It's very common. And discouragement can set in. And this calls for further reinforcement with these engaging and evoking conversations. Because, as I said before, if you have an issue, I'm willing to bet at this point you could get on ChatGPT. If you give it the right prompt, it'll probably give you a step-by-step process to fix your problem. How many people are going to actually do that, though? Especially if it's going to take a long time. So that's where a healthcare provider, and that's where a healthcare provider can step in. And honestly, that's where I'm trying to excel. It's an area where I'm trying to grow as a provider. So this relationship, this act of engaging between us, that lays the foundation. So until you have a clear focus, you actually don't know what to evoke. Like what should we be talking about? What kind of motivation is sufficient for this? So building your motivation for the why you want to change prepares us to set that plan of how we are going to change. And as I said, it's not necessarily linear. These are intertwined. Sometimes we have to skip to how so that you can see a potential path, and then we can go back to why, and then we can go back to how, and we'll change the how, and then we'll implement that plan. But guess what? Setbacks happen. So we have to say, okay, the how plan is not really working. Let's go back to the why. Has that changed? Okay, we need to we need to find that motivation. Maybe that's changed. Maybe we just need to stoke that fire a little bit, adjust the how, and we get back to it. So it's this back and forth between why and how. So we just can't assume that this relationship and working on these chronic issues is a linear process. And this is even true. I mean, if you're going to take medication, if you're going to have surgery, if you're going to have a healthcare provider involved who is maybe more closely related to a mechanic, someone who is actually going to go in and make changes to your body and try and fix things, I don't discourage that at all. I think it's awesome. I mean, I've had surgery, I've taken medication. I think there's an appropriate use for all of these things. Even interventions, like I have patients who they're working with me and they want to go get injections. And hey, if the injection helps, even for in the short term, as long as we have that long-term plan to get you what you want, I think all of these things can be combined and there can be some harmony there. But we just have to understand that this process is not linear. There are going to be setbacks. Don't let the setbacks derail you. You are not unmotivated. You just need to find that motivation from within you. And it helps to work with someone that you trust, that you're willing to walk that path with, and you have that confidence in, and then understand that ambivalence, that simultaneously wanting it, not wanting it, that's normal. It's not you being unmotivated. But when you have a good healthcare provider, you have a good guide, a good coach, they can remind you of the reason why. Why are we doing this? They can get you back on track, and they can adjust the plan if it needs to. And we can go back and forth between planning and why. Planning and why, until take those 2 steps forward, 1 step back, but keep moving in the direction that you want to go until you reach your goals. And throughout this whole process, there's a learning process for you. Some people, they get there and they're good. They can maintain it, and because they've learned along the way. Other people need continuous help. It's so different with everybody. So I hope this podcast on motivation has been helpful. I'm going to keep making these because I think it's valuable. I think this is the biggest hurdle that a lot of my patients go through. Finding the motivation, keeping the motivation long enough, having that motivation actually line up with the plan, understanding the plan, staying on the path, fighting the ambivalence, giving more airtime to the positive side, having that positive mental attitude. This is the hard stuff. This is the stuff that ChatGPT and Google can't give you. At least they can't give you yet. Maybe not until we have like the neural implant, someday. But probably not going to happen to me. But I don't know. We don't have it yet. So if you need help, let me know. Like I said, if you want resources, or you think you're the kind of person who wants to do this on your own, that's cool. I totally support that. Shoot me a message, email, text, DM. My contact info is in the description. Let's engage. Let's talk, and then I'll send you resources that might be useful. All right. Thanks for listening, and I'll catch you on another episode.